Have you ever started climbing a flight of stairs and suddenly felt that sharp, annoying pain right at the front of your knee? That moment when you take a step up and your knee just says, "Not today." I want you to hear this before anything else. You're not imagining it, you're not weak, and you're definitely not alone. Knee pain during stair climbing is one of the most common issues people bring to physiotherapy. And today, I'm going to help you understand exactly why it happens, what's going on inside your knee, and what you can do, starting today, to feel real relief. Imagine this for a moment. You're at home or at work. You start going up the stairs. First step, ouch. Second step, that tight pulling feeling. By the third step, frustration kicks in. By the fourth, a bit of fear. Because deep down you're thinking, why is something so simple suddenly so painful? So many people tell me the same thing. Maybe it's just age. Maybe it'll pass. Maybe I'm doing something wrong. And I always say this, your pain has a reason. And once you understand that reason, you can fix it. Let's take a simple look inside the knee. When you climb stairs, your knee absorbs 3 to 6 times your body weight with every single step. That's a massive load. Now, if your quadriceps, your glutes, or your stabilizing muscles are weak, or if your kneecap isn't tracking perfectly in its groove, that load becomes uneven. And that's when things start to feel wrong. More friction, more stress, more pressure behind the kneecap. Over time, that pressure becomes pain. 1. Patellofemoral pain syndrome. This is the #1 cause of pain when climbing stairs. The kneecap doesn't glide smoothly, it shifts slightly inward or outward. That irritation behind the patella, that's the ache you feel. 2. Osteoarthritis. As the cartilage thins, the bones lose their natural cushion. Stair climbing forces deeper bending, which increases joint pressure. Morning stiffness, grinding sounds, pain up or down stairs, these are signs. 3. Meniscus tears. Your meniscus is your knee's shock absorber. If it's torn, from injury or age, stairs irritate it instantly. Sharp pain, catching, swelling. 4. Muscle weakness and imbalance. If you sit long hours, your quads weaken, your glutes switch off, your hamstrings tighten, and your hips stiffen. It's not your fault. It's simply what the body does when it stays still for too long. The knee ends up doing more than it was designed to do. 5. Poor mechanics. Sometimes it's the little habits. Knees collapsing inward, leaning too far forward, taking the stairs too fast, wearing shoes with no support. These patterns slowly overload the knee joint. And then there are the hidden causes. Old ankle injuries, flat feet, tight hip flexors from sitting all day. These change your alignment, and your knee pays the price. Pain on stairs isn't just a random annoyance. It's your body saying, something needs attention. Left alone, a mild ache can turn into chronic pain, cartilage wear, or mobility loss. But here's the best part. Most causes are completely fixable with the right exercises and small habit changes. When climbing stairs, keep your torso upright. Step through your heel. Don't let the knee cave inward. Engage your glutes as you push up. And use the rail if needed. There's no shame in support. Small corrections bring big relief. 1. Hamstring stretch reduces backward pulling on the knee. 2. Quadriceps stretch helps your kneecap glide naturally. 3. IT band stretch decreases sideways pulling. 4. Hip flexor stretch, a must for office workers. Just a few minutes a day brings real change. This is where the magic happens. 1. Straight leg raises, perfect for painful knees. 2. Wall sits build quad endurance safely. 3. Glute bridges, activate the glutes, your knee's best protector. 4. Step-ups rebuild stair climbing confidence. 5. Mini squats. Retrain alignment and control. These exercises should feel comfortable or mildly challenging, never sharp or stabbing. Your knee pain going upstairs is not permanent. You can strengthen your muscles, you can correct your mechanics, and you absolutely can climb stairs without fear again. If this video helped you feel understood or taught you something new about your body, please like, comment, and subscribe to Relief Motion.